Good morning, everyone. It is my privilege to be here with the IAFF. I am Erin Kobetz, and for the past 3.5 years, I have been engaged in an initiative called the Firefighter Cancer Initiative. I am representing the voice and lived experience of many firefighters across the state, some of whom are in the room today. This work that I'm about to tell you about is not just my work, it's our work. We have done research together, developed educational programs and new technologies that we hope will expand beyond the boundaries of Florida to keep all of you safe. So before I start, where are my Florida Health and Safety Collaborative people? Stand up. This is their work, and these are my heroes. And not represented here today, but always with me, sitting on the shoulders, are the wings of our friend Butch Smith, who passed away from multiple myeloma and inspires much of the movement that I'm about to tell you about. So many of my colleagues have already told you very eloquently that there's an increased risk of cancer among firefighters. And one of the challenges of taking this evidence and moving towards presumption is something called the lack of a consolidated firefighter cancer registry. So what do I mean? Anybody who has cancer has their information reported to their state incident cancer registry. It's anonymized, but anybody who has cancer is tracked from the time of diagnosis to death. And that helps us survey cancer within the population at large and understand emerging trends about new disease or risk of mortality. So one of the first things that we've tried to accomplish in the state of Florida, and I'm happy to tell you, is that we created the first state firefighter cancer registry. And what this allows us to do is to identify firefighters within our cancer incidence registry who have been diagnosed with disease. What happens is when most data is shared with the registry, information about occupation is not consistently recorded. Or, as Dr. Burgess implied, many firefighters develop cancer after they've retired. So if you're diagnosed with cancer 2 days after you retired, the information shared with your state cancer registry is that you're retired. And we miss the opportunity to truly capture the risk of cancer among firefighters. So this has been a huge success for us. I'm going to share some of our preliminary data through the linkage that's been afforded by this new legislation, which helps us substantiate that there is an increased risk of cancer among firefighters living in Florida. Now, this data isn't significantly different from what you've been showed before, but what's telling for us is that when the last linkage happened many years ago, we have started to see an increase in new cancer sites among firefighters. And more importantly, that in sites where we already knew there was elevated risk of disease, we're seeing an increase in the baseline rate of firefighters that's been reported in peer-reviewed literature. So that gives us pause as scientists and as firefighters to really ask telling questions about what is happening and what we can do. We are now moving to conduct a meta-analysis. We're hoping with an additional year of funding from our state legislature that we will be poised to do this kind of work, which will help account for all of the new data that has been collected and presented across many studies to further provide evidence for the types of cancers that firefighters are at increased risk of developing and dying from. All of the work that we do is organized using this framework. This is the socio-ecological framework, and I know that sounds super academic, but what I want you to draw from this slide is that we don't perceive that firefighters exist in a vacuum. Firefighters exist in organizations, they exist in communities, they exist in spheres that are influenced by public and social policy, and our work cuts across all of these realms of influence. And what I'm going to tell you is a little bit of the story of the work that we've done on each of these levels, and hopefully invite your participation into what we're trying to accomplish. We've had tremendous, tremendous support from Florida firefighters, and many of these opportunities are not Florida specific and are open to any of you who are hoping to benefit from involvement. So we do a lot of lab-based research. We actually have, I believe, the first firefighter mouse colony where we have mice that we are exposing to known carcinogens and other substances that firefighters encounter in the field. And that's giving us clear evidence for the etiologic process by which cancers develop in firefighters. More interestingly, we just conducted a series of analyses looking at differences in firefighters who have high exposures to carcinogens and firefighters who have low exposures to carcinogens. And we developed those demarcations using data that was shared to us by the firefighters. What we found when we looked at those differences is that we saw key epigenetic changes in known genes that are associated with cancer, and that the difference between firefighters with high exposures versus low exposures was statistically significant. Now, why do epigenetic changes matter? That's a big word, and it's talking about change that occurs in genes. Well, genes influence cell function, and epigenetic changes happen as a function of environmental exposure. So it starts to give us the biologic pathways to hunt down so that we can understand which particular exposures are driving risk, and then look for those signatures in tumors themselves. One of the things that we've done in Florida, and it's not necessarily state-specific, is we have a firefighter tumor bank. So we are collecting tumors from firefighters diagnosed with disease from across the state of Florida, and we're banking them so that we are poised to ask really novel research questions about exposure and outcome. And more importantly, what we hope to glean from this research are new therapeutic targets that allow us to more effectively treat firefighters with cancer. Many of the firefighter cancers that we see in Florida occur in younger individuals, and it's an earlier onset that's much more aggressive in scope. And so we need to come up with new therapies, and more importantly, we need to come up with new prevention. We have done a lot of work with the turnout gear. And what you see here is a study that we are doing to try to understand for how long the turnout gear was eliminating or off-gassing known carcinogens. We're also very interested in developing wearable technology. So we've done a pretty extensive literature search, mostly through the help of our firefighter colleagues, which has shown that there's very few opportunities where the gear itself can have sensors and technology integrated into them that allow us to monitor and quantify the amount of carcinogenic exposures that are happening in the field. And so we are working to develop this, and we actually have a prototype that we're about to take into the field in the next 6 to 9 months that might allow us to advance understanding of the amount of exposure that's happening to firefighters on each individual call, and then also over the life course. Sorry. Okay, so one of the things that we also did in this same vein was we developed wristbands, silicone wristbands. Some of you are probably wearing them in the room. I know for certain Sam Eden is. These are the Livestrong wristbands that were popularized by Lance Armstrong when he was in fact still popular. And these wristbands, before we know he doped, but these silicone wristbands can be worn by firefighters into a call. And we can extract PAHs, known carcinogens, and quantify them in a way that we can then also measure those same exposures in blood and urine. And I think this is one of the most exciting things that we are doing right now. These bracelets are super cheap. The technology to process them is super cheap. And once we can validate them in relation to key biomarkers on firefighters who are wearing them, it's really going to advance our ability to collect important data that informs our understanding of what's happening in the field. Most medical records do not include information about your exposures across the life course. And we really need to understand that to start figuring out how to prevent and better detect cancer. Here you see some very fancy scientific artwork that shows the level of PAHs that were detected from bracelets that were worn by firefighters. And what we see here is that the amount of PAH exposure from one fire is 30 times higher than what is recommended by OSHA. We also recognize that the fire stations in which people work in their departments influence practice and certainly influence behaviors related to cancer screening. So we did a very large survey with firefighter leadership throughout the state of Florida, focusing on key organizational domains that may influence cancer screening and decon behaviors. And what we found was really interesting. The scientists at the university and some of our firefighter colleagues were convinced that smaller, more rural departments were going to be less likely to engage in cancer screening. And that's not actually what we found. It has nothing to do with the size or the location of the department. It has to do with the number of the safety and health officers with a given department, and more importantly, whether or not there are written policies and practices in place to promote health and cancer prevention. And so now we are working with the State Fire Marshal's Office throughout the state of Florida to actualize this information. I should have said from the get-go that the State Fire Marshal's Office is our biggest partner in all of these initiatives, and we work hand in hand to try to ensure that the research that we develop leads to action. It's not enough for me as a scientist to publish in high-impact journals. I have to take the knowledge to benefit firefighters, and that's what we're doing through our partnership with the State Fire Marshal's Office. Okay.
So this is
now I'm showing you a video.
Super invisible powder that's used actually for theft detection and cash, but one of the things we're trying to simulate is pretending that this is black soot, just the same type of soot that comes off combustible or burning materials you would encounter in a fire incident response. The initiative actually came to us right, from the Palm Beach County Fire Rescue Department. They were very interested in understanding about how what they did for work was impacting their health, specifically how maybe being a firefighter or an EMS responder may increase their risk for cancer. One of the things we were trying to do today is figure out, is there a way we can demonstrate how maybe cancerous materials are transferred from a fire incident response back to the fire station and personal vehicle. And so today was really a teaching exercise and a scientific exercise of trying to see how we demonstrate where soot, represented by this invisible dye, might be transferring from when they go to respond to a fire and come back to the fire station. So the goal today was trying to be able to identify, can we feasibly show how soot is transferred from a fire incident response back to their truck and back to the fire station. As you start going through the different scenarios of post-decon into the fire engine, back into the bunk, into the restrooms, back here to the coffee table, it starts becoming less visible to the naked eye. But that powder that is invisible over chronic exposure could be potentially causing cellular changes that we just don't know about yet. And hopefully through some of our studies we can start identifying those changes. It was really an eye-opening experience for us because I anticipated, some demonstration of how much dye would transfer. I didn't realize the breadth and scope of how much dye would spread within the different scenarios that we were shooting in, as well as continue to transfer on after the first fire engine truck. So for me, it was very impressive to see even some of the invisible dye transfer onto the bunks where they're sleeping at night. Even if it's a smaller quantity, you could imagine that low-dose chronic exposure of this dye might be potentially increasing the risk over time. We filmed today in the EMS's personal vehicle. You could easily see even fainter wisps of plume of dye on the ceiling as well as on the seat that were not direct contacts, but were physically visible on it, suggesting that the particulate moves around. So you might not visibly see soot, and in this case we got to see a dye, but that could potentially be increasing your cancer risk. The firefighter works as a fomite and is transferring, carcinogen from where their place of work back to their personal home. So we had an opportunity to have a child with us today to be able to demonstrate maybe what happens in passing some of that soot using a soccer ball. So we were able to have a child play with one of the EMS firefighters with that soccer ball, and we were able to see a second-degree transfer of this invisible dye, i.e. the soot, transfer from the EMS to the soccer ball and to the child. One of the activities that I hope arises from this video that we're producing is that firefighters are a little bit more cognizant about how hygiene is a very important aspect, and decontamination is an important aspect of post-incident fire response, because it makes them a little bit more aware of not only of the soot that they bring back into the fire station, but also what they might be taking to their personal homes and sharing with their families through secondary and tertiary contact of this soot on their own person. And I hope that the firefighters see that as a way of creating an opportunity for awareness and discussion of how we improve hygiene and decontamination within the fire service.
That video is really powerful and very eye-opening. And I think for a lot of firefighters that I've met in my journey, that video convinces them that it's time to start having a conversation about cancer. And if the conversation has already started, to start really moving to strategies and techniques to reduce exposure on the job and in the home. I wasn't planning to talk about this, but yesterday one of my colleagues who is an expert in osteosarcoma treated a little girl whose father was a firefighter. And he said, all I could think about was that video and the dye. Should I show it? I said, no, I don't think you should show it. I don't think that's going to help. But what we are trying to accomplish in the work that we're doing in Florida is to really move the dial on prevention and risk reduction. And so I leave you with the story of two other things that we are accomplishing that we look to you for collaboration and participation. One, we have developed a train the trainer manual that will be provided to all of our safe and healthy officers throughout the entire state. And it will also be integrated into the curriculum of all rookies who participate in our state fire college. We want to start the awareness about cancer early in the job so people consider signs, symptoms, and strategies to reduce risk and reduce exposure. And last but not least, with the State Fire Marshal Office, we are about to distribute 6,000 decontamination kits to fire departments throughout the state of Florida. The contents of the kit were developed through our research and then operationalized by our colleagues at the Florida Health and Safety Collaborative, our team FACE. Together, we developed the standard operating protocols that will accompany these decon kits. So fire departments that may not be part of this conversation now, not only are aware of the need to join what we're doing, but also how to keep their members safe. And we're really, really excited about that. And certainly the video will be accompanying every one of those decon kits. So if people don't know, they will. Now, last but not least, this is a picture of some of us together at the Sylvester Comprehensive Cancer Center. And this is one of my favorite pictures. I have it in my office because it speaks to the possibility of what we can accomplish together. I am a cancer researcher who grew up studying cervical cancer in medically underserved women. And many years ago, I was approached by leadership at Palm Beach County Fire Rescue to join them in an initiative to try to understand why firefighters were developing and dying of cancer. And answering that call has been one of the biggest privileges of my career and also that of the Sylvester Comprehensive Cancer Center. We feel that in working together with our firefighters that we are poised to accomplish something really great, where when you invite me back in 5 years, we'll start to see some real shifts in the trend of cancer among firefighters. If any of you are interested in accessing that video or other educational materials and videos that we've developed, they are all available at SylvesterNewBadgeOfHonor.com. Thank you very much for your time, and thank you so much for your collaboration.